Addiction is a medical condition that affects the brain and changes a person's behavior. It's characterized by a loss of control over a person's behavior, as well as continued use despite consequences, such as loss of a job, arrest, damaged relationships, or other significant negative outcomes. It can happen to anyone regardless of race, age, or socioeconomic status. Too often, substance use disorders are treated like an acute issue or a choice instead of a chronic disease. Movies, TV, and commercials often reference rehab stays or one-month treatment programs that sound like a cure. But unlike a common cold, the flu, or pneumonia, addiction does not resolve quickly or just disappear. The impairment in self-control is the hallmark of addiction. What was once a decision to use turns into a compulsion. This is why engaging with treatment as soon as possible is so important. A chronic disease or illness is persistent or long-lasting. While they often don't have a cure, you can live with them and manage their symptoms. Common chronic diseases include heart disease, asthma, and diabetes. Top researchers note that drug addiction shares many features with other chronic illnesses, including a tendency to run in families, an onset and course that is influenced by environmental conditions and behavior, and the ability to respond to appropriate treatment, which may include long-term lifestyle modification. Healthcare providers often categorize conditions as either chronic or acute. So what's the difference? Acute illnesses generally develop suddenly and last a short time, often only a few days or weeks. Examples include the common cold, flu, bronchitis, pneumonia, strep throat, or heart attack. Chronic conditions develop slowly and require a longer-term treatment and management strategy. Examples include Alzheimer's disease, depression, diabetes, heart disease, obesity, and addiction. Managing relapses is also a key component of a chronic care plan. For a person recovering from addiction, returning to drug or alcohol use after a period of remission does not mean that the patient or the treatment has failed. Relapse is better understood as an important indicator that the care plan needs adjustment to better align with the patient's needs. Setbacks should be met with the changes in the care plan to help the patient alter and continue their chronic disease management course. When taking this approach, these changes can help strengthen the patient's care plan and provide a wealth of insight and knowledge for the patient moving forward.